Hi, I'm Dr. Michael Stubblefield. I want to welcome you to our Living Well Beyond Cancer Survivorship series. I am honored and privileged to be able to kick off the initial presentation and give you an introduction to cancer rehabilitation. So first, a little about me. I'm the medical director, the national medical director for the ReVital Cancer Rehabilitation Program. I'm based at the Kessler Institute for Rehabilitation in West Orange, New Jersey. I'm a cancer rehabilitation specialist, which means I'm a specialist on identifying, evaluating, and treating all of the issues, particularly the neuromuscular, musculoskeletal, pain, functional, and other issues that go along with cancer and its treatment. I work very closely with a very large team of highly skilled and knowledgeable therapists, including physical, occupational, and speech language pathologists, with the sole mission of restoring function and quality of life to cancer survivors. So what I want to talk about initially is just the cancer journey. It is very different for everybody. Everybody comes with their own age, their own family situation, their religious beliefs, their social position, everything else, to what is really a very large array of different diagnoses. You may be diagnosed with head and neck cancer, or breast cancer, or lung cancer, colorectal cancer, gynecological cancer, lymphoma, etc. And each one of these cancers is going to have its own set of treatments and its own set of issues that goes along with it, which is going to be layered upon you. The things that you bring to the table. You may have had arthritis or rheumatologic condition or diabetes or heart disease, or been completely healthy, running 5 marathons a year before the diagnosis. One of our major jobs is to try to tailor our interventions, our attempts to restore your function and quality of life to not only you as a person and your experiences, but also the cancer that you're going to be treated with. So what is cancer rehabilitation? Well, it's a process. It's a process that helps cancer survivors obtain and maintain the maximal possible physical, social, psychological, and vocational, meaning work, functioning with the limits created by cancer and its treatments. Basically, it's a team effort that requires multiple people potentially to help get you to that highest possible level, to help you do the things that are meaningful to you. That may be caring for your children or your grandchildren, or working or golfing. It's a process that's designed to get you back to where you were or to where you want to be. Now, that's not always possible, but our goal is to get you to that highest possible level within the limits that cancer, and importantly, the treatments of cancer, have created. So why cancer rehabilitation? Well, if we look at cancer survivors, we know that the vast majority of them are going to have some sort of issue related to cancer and the treatment of cancer that affects their function, their ability to walk, to move, to work, to do things that they want to with their family. And some cancers have less issues, some cancers have more issues, but regardless, we know that less than 2% of the patients who have these needs ever get comprehensive or any cancer rehabilitation services to get them back where they want to be. So the ReVital Cancer Rehabilitation Program, our basic mission is to change that and to provide those services, make them readily available to the people who need them. So what are the common issues? Well, again, it depends on the type of cancer you have. I commonly talk about head and neck cancers and breast cancers because those are not only common, but they have a whole list of issues that are very likely to happen as a result of them, and very importantly, their treatment. But that doesn't mean that colorectal cancer or lung cancer or a sarcoma or a lymphoma or any other cancer that you or a family member has doesn't also have issues that go along with it. Those issues are pain, is one of the most common issues. Believe it or not, the most common is fatigue that can occur as a result of not only the cancer, but the treatment of cancer. Some people will have mild cognitive impairment. Some people will have neuropathy, meaning numbness and tingling, or even pain in the hands and toes, sometimes with weakness and balance and trouble walking issues. Some patients will have a problem with activities of daily living. Those are the things that you do in your everyday life, from brushing your hair and your teeth, or going to the bathroom to balancing a checkbook or grocery shopping or taking care of your children or grandchildren. Those usual activities that you need to live in your everyday world can be badly impacted by cancer and its treatment. Lymphedema, which is abnormal swelling that occurs when we take out lymph nodes in certain regions, which is a common place where cancer spreads, or we provide radiation to keep cancer from recurring in those areas. And the lymphedema can occur in your arms, in your legs, in your chest, in your head, in your neck, depending on which region of your body was subjected to the treatment. Getting back to work, that's a huge problem. As people work longer and and cancer hits younger and younger people, that becomes a major issue. And we want everybody to be able to do the things that they enjoy doing. Living independently, right? If you're an older person who's been living independently and you get cancer, you don't want necessarily to have to rely on your family members to take care of you going forward. You want every opportunity to live as you lived before. So one of the concepts that I think is most exciting about the ReVital cancer rehabilitation is this idea of prospective rehabilitation, which we call ProHab. Some of you may have heard of prehab. Prehab is that rehabilitation efforts that occur from when you're diagnosed to when your treatment starts. So if you're a breast cancer patient who can't get your arm above your shoulder for the treatment you need, we might do ProHab to get your arm. Or if you're a colorectal cancer patient who already has trouble walking, we might try to rehabilitate you to improve your gait and your balance and your ability to do things before you start on the cancer treatments. The problem with that is it's a very narrow period of time from that initial diagnosis to that treatment. So the idea of prospective rehabilitation is we know that you are going to have issues that come up over time. So we want to be there to educate you on what those issues are, and very importantly, try to minimize their impact on your function and quality of life. So this is a typical cancer treatment program for a patient with breast cancer. Again, this can be applied to any cancer type. You're going to be diagnosed with your breast cancer. Then you're ultimately going to have probably resection of your breast cancer. Sometimes chemo comes first, but usually the surgery goes first. You're going to have a recovery time from that surgery where you may have trouble moving your arm. You may get some swelling. You may have some pain. You may have other issues that crop up just from the surgery. Then we're going to give you chemotherapy. And that chemotherapy causes the neuropathy, the numbness, tingling, weakness, trouble walking. It can also cause cognitive issues for patients. Then you're going to finish the chemotherapy. Then you may go to radiation. And that radiation is going to further affect your ability to move your arm and might contribute to more arm swelling or lymphedema, might cause range of motion limitations so you can't reach above the cabinet, to get a bowl or to do the things or lift your grandchild in the air. So our goal is to get in front of each one of those points of treatment so that we give you the activities you need, we give you the education you need to allow you to do the things you want to do. And if the things get worse during that time, we'll really redouble our efforts, put you in a formal rehabilitation program to try to optimize, try to make you as good as we possibly can, considering whatever happened to you. So if you came with really bad shoulder arthritis before your breast cancer surgery, our expectation may not be to get you to have completely full range of motion, but we want to make sure that your arm isn't just stuck down at your side. And then even when you finish, issues can come up long after your treatment is done. And we want to make sure that we are ready to help you navigate any of those issues that come up. Again, this doesn't have to be a breast cancer patient. This can be any cancer type. The basic principles are the same. We know there are going to be issues, and we want to help prevent those issues. So how can it help you? As I've said repeatedly, our goal is to help give you the best possible level of function, meaning ability to do your activities of daily living, walk, go to work, play with your kids and your grandchildren, do the things that you need to do. And to do that, we have several sort of services depending on what you need that will give you there. So let's use this patient as an example, just a wonderful man, head and neck cancer survivor, whose big hobby is enjoying rock climbing. Now, interestingly, That's not his biggest issue. His biggest issue was that he couldn't open his mouth. So when he came to us, I diagnosed the problem. I also educated him on other issues. Again, I'm the physician, so my job is to diagnose the medical problems and then provide treatments as needed and further investigation as needed. So if I need to do MRIs or PET scans or other imaging, I can order that. If I need to order laboratory testing to determine if the patient has a rheumatologic condition or diabetes or something else contributing, I can do that and either treat it myself or work with my colleagues to get it treated. I can also do pain management, giving various types of medications. I do a number of injections, etc. In a lot of patients, they don't need that. They don't really need my services as much as they need the services of a physical occupation or speech language pathologist. In this patient's case, his problem is he couldn't open his mouth, as I said. So he went to a specialized physical therapist and to a specialized speech therapist to do therapeutic modalities, interventions to help get his mouth open. So he went from barely being able to eat to being able to eat a hamburger. Now, these things can get worse over time. And I'm not here to say that everything is always perfect. It's one and done. I will continue to follow this gentleman for really as long as he lives, which, given that his cancer has gone away, may be his lifetime. And he will continue to need therapy services when and if other issues pop up, such as trouble getting his arms above head or weakness lifting his head up or worsening swelling of his head and neck, that sort of thing. If you're a colorectal cancer survivor, you may have had a resection and have abdominal pain and have trouble doing some of the things you want to do from the chemotherapy, like walking, or you may be prone to falls. So those are all things that we can help you with to, again, help you have your highest possible level of function and quality of life. So why is therapy important? As I said, I'm the doctor. My diagnosis is to help figure out what's going on with you and to put you on a treatment program that is going to be most effective for you. That said, I'm completely useless when it comes to doing the hands-on physical interventions. That's what our very highly trained, very knowledgeable, very skilled physical, occupational, and speech language pathologists are for. This is what they do for a living. They're going to look at you from a completely different way than how I look at you, much more function-based, much more impairment-based. If you're having trouble walking, they're not going to get into the medical diagnosis of why you can't walk. They're going to look at you holistically, and they're going to work on your posture and your positional awareness and your strength, and ultimately, hopefully, have you walking better with much less falls. And they're going to do that in a way that hopefully will help keep you in good shape as long as possible. So having me talk about the importance of therapy is not nearly as important as having some of our therapists talk about why their services are so important and what they can do for you.
When diagnosed with cancer, there are a lot of unknowns, and our patients are wrapping their brains around language they've never heard before, PET scans, regimens, tumor staging, and trying to become an overnight expert of what all of that actually means. Thankfully, one thing a patient doesn't have to worry about or become an expert in is how to protect and prepare their bodies for treatment and recovery, because that is exactly what a cancer rehab physical therapist does. A physical therapist works with people during all stages of treatment as their recovery coach. I help prepare people physically for cancer treatment with strategies, exercises, and expectations so that they can feel more in control. I work with patients during treatment to help expediently address side effects and minimize any discomfort. I work with patients after treatment who haven't returned to their prior level of function.
OT, or occupational therapy as a whole, focuses on the occupations we do during our day. So either getting dressed, cooking, taking care of grandchildren, hanging out with family. So as a cancer rehab OT, I have to identify what patients really like to do and how they need to spend their time. and then I get to enable them to do that occupation. So I'm kind of this fun cross between a physical therapist and a speech language pathologist, because I can use physical interventions, so exercise, range of motion, strengthening, things like that, that enable somebody to move better during their daily occupations. But I can also do cognitive work as well. We can modify and adapt tasks. So how do we give you little cheats and tricks to make things easier, as well as still skill building. So eventually you won't need those kinds of cheats and tricks anymore.
Hi, my name is Erin, and I'm an outpatient speech therapist. I have the pleasure of working extensively with patients with various types of cancer. And as a speech therapist, one of the things that I get to do is help them improve some of the most fundamental human needs, which is their communication and their swallowing function. Cancers of the brain can often result in difficulty of someone understanding what other people are saying, as well as difficulty making their own wants and needs known. Speech therapists can work with these individuals to help them improve their functional communication and increase their independence and their ability to participate in social interactions. The other major area that speech therapy can help to address is swallowing function. This is something that can be the result of various types of cancer, including brain cancers and head and neck cancers. We as speech therapists can help them improve not only their nutritional and health status, but also improve their quality of life by their ability to participate in meal times with family and friends.
I've had multiple family members diagnosed with cancer, and so being able to be a cancer rehab specialist is really rewarding, because I get to give people power back when cancer treatments kind of take that away from somebody. And it's just really rewarding to be able to participate in somebody else's journey with them and make it easier in whatever way I can.
Thank you, Dr. Stubblefield. So now we're going to go to live Q&A, and I am just going to read off the questions that I am seeing in our inbox. So obviously there's no names, everything is anonymous. I was diagnosed with breast cancer 7 years ago and had a double mastectomy with reconstructions and 4 rounds of chemo. Late last year, while working with a therapist to help a shoulder injury, she determined I was suffering from lymphedema, which I did not know I was having. I did therapy with her and am still working on it. Just curious if there are any nutrition books you can recommend. Thank you. Dr. Stubblefield, do you have any insight on that one?
Yeah, no, thank you. And I'm going to assume you can hear me okay? Okay,
Yeah.
good. Because I'll have to admit to the whole audience, I couldn't hear that whole presentation for reasons that are obscure to all of us. So yeah, there's unfortunately there is some literature out there on nutrition and lymphedema, but really not a tremendous amount. And I'll have to admit that from my point of view, I don't really have any textbooks or other sort of patient-facing books to recommend. I see a couple of our other panelists are on there and see if they have other ideas for nutrition and lymphedema.
As a lymphedema therapist, I can say that one thing we always educate is there is research that suggests increased weight can contribute to the occurrence of lymphedema. And so obviously a healthy diet and basic exercise, walking and lots of water, which some people are surprised at, but that is one thing that we are educated to share with our patients.
Yeah, I think that's spot on. I mean, there really, I'm hedging on this because there really isn't that much on it. The keeping your weight down is absolutely critical. For people who are interested in sort of, alternative and complementary sort of therapies for cancer treatment in general, Memorial Sloan Kettering Cancer Center has a tremendous website that has a lot of information on there. It's probably the best that I know of. So if you're looking for a resource, I would check that out. But again, I don't think there's any specific food or food item or vitamin you can take to treat lymphedema. Keeping your weight down is really, one of the best things you can do.
Okay, I'm going to move on to some more of our questions. We have somebody who is asking if they will have neck lymphedema forever. It's a lifetime risk when you have lymphedema. And if you have been able to locate a qualified, certified lymphedema therapist, they can educate you, like all ReVital therapists, on the things that you can do to reduce that risk. There is self-MLD, actually seeing a therapist. There are garments, skincare, exercises. So there's some things you can do to reduce the risk of lymphedema. And some people have it and it goes away. And unfortunately, some people do have to deal with it on and off throughout life. Is there anything you wanted to add to that, Dr. Stubblefield?
Yeah, I think that's, again, currently spot on. Lymphedema, like a lot of late effects of cancer, are lifetime conditions. The treatments we offer are usually fairly effective, but you're always going to have to do some treatment when you have it. There are some surgeries out there people are doing. I'm not a proponent of them because we really don't have long-term data. And even if you had say a lymph node transfer surgery for lymphedema, you still need to do all of the maintenance of the lymphedema that you have that surgery. So there's no magic bullet here at this point in time. Cell transplant's not coming to the rescue anytime soon. It's really like a lot of chronic medical conditions, just something that has to be managed. And that's one of our goals, though, is to give you the tools to manage lymphedema as effectively as possible.
Excellent. Next question that we have is, how long after treatment ends might one receive such rehabilitation? I had melanoma in my cheek 5 years ago, surgeries, skin grafts, and radiation.
Yeah, that's a great question. So radiation in particular, I talk about as the gift that keeps on giving. There literally is no expiration time where the radiation is no longer going to be an issue. The longer you live, the more potential issues you're going to have from radiation. So the simple answer to your question is you can have therapy at any point in time to treat the late effects of cancer and its treatment. So if you had cheek radiation, you're having trouble opening your mouth, you're having pain, you're having lymphedema, all of those are things that we don't manage that are going to need to be managed to some degree indefinitely.
I hope that answered that question. So the next one I have is, how do I sign up? I was recently denied referral for PT, sad face. I'm recovering from chemo. And my question just went away, but I can tell you how to sign up. And we're going to speak to this on the slides and at the end of this talk as well. You can go to our website, which is revitalcancerrehab.com. When you look on the website, you can locate a therapist and you can contact the therapist and they can help you get an order off your doctor. Some states allow you to see physical therapy direct access and some do not. Occupational and speech therapy generally need an order from a doctor. So that's one way you could do it. Or, and this information will be on the slides as well as spoken to again, you can call our national phone number, 844-473-8485, and that will get you to a cancer rehab therapist and they can discuss further with you your needs, what clinic is close to you, and what type of therapy would be good for you. I hope that answers that one. We've got some questions here that we're going to type answers to. So people asking, do you know of a physician in Phoenix area? We have clinicians in the Phoenix area, so we'll try and get someone to answer that in a typed answer to you. Somebody else is saying Eat Well Through Cancer is a book that they have found useful. How do you treat, this is a great question, how do you treat long-term chronic neuropathy in the feet and hands?
Yeah, that's a great question. So neuropathy is not just one disorder. And it's not just one set of symptoms. So the first question I'd ask is what do you mean by neuropathy? Are you having numbness and tingling? Are you having pain? Are you having trouble with balance? Are you having trouble walking? Have you been falling? Some people even have what we call autonomic problems, where their heart rate and blood pressure don't respond normally, or they have bowel or bladder issues. So neuropathy is a very wide spectrum of issues. So depending on what you have will depend on what you're offered. So if you have pain, we actually have medicines that are reasonably effective to treat pain, and therapists have some techniques that they can employ that will also help pain. Numbness and tingling is a little harder. The medicines won't fix numbness. The therapist can't really fix numbness, but they can do some desensitization techniques. Weakness, that's something that we actually can train, that we can usually make patients, stronger if they would be if they didn't work with us. Rarely if somebody has really bad weakness, we may need to use like a foot brace or something like that, their gait, which is actually a pretty low profile device and actually pretty effective. So again, it very much depends on what you have. There is no cure for neuropathy that's caused by chemotherapy. Sometimes it will get better over time. Sometimes it won't. Our goal is to really manage the symptoms and make your function and quality of life as good as possible. I don't know if you have anything to add.
Yeah, so as a therapist, I would say I've seen great outcomes. Physical therapists can, especially if you're noticing it in your feet, if it's contributing perhaps to a loss of sensation and falls, then definitely balance therapy, certain soft tissue techniques, taping can help with neuropathy in the feet. And then obviously, as an OT, there are many things that we can do to help you educate how to manage neuropathy in your hands. Again, taping, soft tissue techniques, some weight bearing, activity modification. So there are many, many things that you can do. And I really encourage you that you don't just accept that this is your life with neuropathy. I encourage you to speak to your doctor, or to also speak to a ReVital cancer rehab therapist. So I hope that answers the neuropathy question. I am just searching through some of the other questions. I am a 3-time cancer survivor and battling my 4th. I've had a pleural decortication to try to wipe out the mesothelioma in my lungs chest. What kind of therapy would help strengthen my back to ease the pain? My first thing would be physical therapy. Generally, we think that physical therapists will help you with back pain, strengthening, activity modification, and risk reduction. The role of the occupational therapist here would be if there are specific functional activities that you are having issues with, then a clinic that offers OT and PT may be a really good option for you. So you could do both of those therapies. But first stop would probably be a physical therapist. So I hope that answered that question. I'm still searching through. We have a lot of questions here, so I really appreciate everybody. My mother is 86. She had breast cancer 25 years ago with severe lymphedema. When I was diagnosed with breast cancer and started ReVital, our PCP sent her to ReVital 2 for new treatments. She got her sleeves and exercises and dramatically reduced her swelling. So it sounds like we have a happy ReVital customer there. How effective is the pump for lymphedema? Is it necessary even for mild lymphedema? Again, as a lymphedema therapist, there are many pumps out there. The FlexiTouch is the pump that I recommend. Unfortunately, many insurances will deny that or require you to use another pump first before you get to that pump. Some patients love their pump and others really, because of the time constraints, many times a pump is something that requires you to sit still for a good hour or so a day. So for many people, a pump isn't their option. It's just very individualized, like everything. Everyone's cancer journey is different. That is what I would encourage if you still have lymphedema, that you see a specialist and you discuss that with them.
I'll just add a little bit. I agree with absolutely everything Kirsty said. One of the caveats I would put is, where is your lymphedema, right? If we're talking about upper extremity lymphedema and it's mild and you're well controlled and your volumes are stable, then, you usually can't get away without a pump. Same thing for lower extremity. One of my things is patients who have head and neck lymphedema, the FlexiPen for that. And I'm a big proponent of using it because I think it may help some other late effects of head and neck cancer. So I've been using it really quite extensively.
Excellent. So we have a speech therapist on the panel, and we have a question for speech therapy. So our question is, how does a speech therapist help with eating? Erin, are you able to help us out with that?
Absolutely. Can you hear me okay?
We can.
Okay, perfect. So that's a really significant area that we can address for this population. The evaluation usually starts out with just some kind of subjective question and answer about what types of difficulties have you been experiencing. That can range anywhere from a patient, not being able to consume anything by mouth. They might have to use some supplemental sources of nutrition, or maybe they're pretty much eating a normal diet, but they're just noticing some changes day to day. From there, we can make some judgments on what consistencies are helpful for them to trial, and we can watch subjectively and see how they're dealing with those. We're looking for overt signs and symptoms that something might be going wrong with their swallowing, such as significant coughing or wetness in their vocal quality. We can also do certain instrumental evaluations, often referred to as video fluoroscopic swallow studies, modified barium swallow studies. And this is where under radiation, under X-ray, we can watch as you eat and drink various consistencies and see really objectively what's going on with the physiology of your swallowing function. And from there, we can determine what's the most appropriate diet for you to continue on. And again, that can range from anything from just trialing little bits here and there to or giving you the all clear to really continue with a normal diet. But we can also determine what strategies might be helpful. So maybe you have to use some positional changes, like tucking your chin to your chest or turning your head to your side when you swallow, to help reduce risk that things are going to be going down towards your lungs. And then we can also see where those areas of weakness or fibrosis may be, and provide some direct exercises that can help to address those functions, so that we're kind of attacking the problem from two sides, not just the compensatory approach where we can provide strategies to help more in the short term, but also a restorative approach to help improve the muscle function itself and kind of improve the big picture of the swallowing function.
Thank you. That was a great answer. Next up, we have a question for physical therapy. So we're going to get Hillary on. And I think this is a great one as someone that could exercise more. Do I need to have exercised in the past to go to physical therapy?
Hi, so glad that we're discussing this, because I think that that's a big misconception, is that your prior level of function would determine your future level of function. And what we're trying to encourage all of our patients in our cancer community is to really claim their quality of life and what they want moving forward to look like. So the short answer is no. If you've never exercised before, there's no better time to start than whenever you're ready to make a change. We just want you to do it safely. So depending upon if you're you're receiving active treatment or if you've completed treatment, your program may look different. And that's why I'd really recommend linking up with a physical therapist that has oncology background and awareness and training so that they can know the impact that certain treatments are having on your body and how they'll have to scale your exercise appropriately. Something to consider when you think about exercise and movement as medicine, most people are familiar with the doctor giving you a new medicine to take. And sometimes you have to modulate or play with the prescription, the amount of the dose of the medicine until it really seems to jive with your body and help to manage your symptoms. Exercise is medicine that we dose. And so sometimes we test different exercises, movements, or amounts of exercise in the clinic to see how your body tolerates it and if you can be safe with that. And then we modulate or change the dosage based on the result. Are you feeling better? Are you having more energy, like cancer-related fatigue? Do you feel like you can do your day-to-day activities with less discomfort? Those are signs that the medicine's working and the dose is appropriate. Are you too worn out? We're going to change the dose. And so I think it's just all about working with a therapist to understand your body, but you absolutely don't have any exercise experience. You just want to partner with somebody who can guide you through the process safely.
Great answer. And can I follow up, Hillary, and ask, as a physical therapist, what are some things you do with your patients for neuropathy?
Oh, great question. So this is something that I think my practice has really shifted within the past couple of years. And I think the ReVital National Network, I'm not even scheduled to say this, but it's true because we've been able to network with one another and learn best practice and what's working for patients across the country. So your treatments may look different, but the side effects for many different disease states are very similar. So when we can collaborate with our peers, we've gotten a lot more ideas and out of the box ideas. So a couple of the things I'll do for neuropathy is taping, therapeutic taping. It has been a strategy that I have seen good results with in clinic over the past couple of years. Depending upon the neuropathy, we're not going to be able to change any type of neural damage that was done based on, the chemotherapeutic agents that you may have received or the reasons that you're having neuropathy. What we can change is the way that we impact the nervous system, the way that you perceive different things and the sensitivity of your nervous system, as well as nerves love blood, space, and movement. So when you're talking about addressing neurological symptoms such as chemo-induced peripheral neuropathy, we want to try to get blood, space, and movement to those nerves to get them really happy. And then using strategies like therapeutic taping has worked really well. I like to do a lot of lower extremity exercises that glide the nerve in functional postures. So practicing things in standing, as well as desensitization techniques. So teaching you ways that you can kind of adapt the way that your body perceives sensitivity and see if there's room to adjust your body's threshold or the way that you perceive things. Another thing that is important to me always with anyone who has symptoms of neuropathy would be to check balance. There has been evidence that shows, that if you have neuropathy, which is not unique to the cancer population. There's people who have diabetic neuropathy or other types of neuropathies, and sometimes their balance can be impaired because of the changes in sensation. So I always like to check balance as well as incorporate some balance and flexibility exercises in their routine as well.
Thank you. That was a great answer. So I have another question here for speech therapy. And somebody is putting in here, and these questions are coming in hard and fast, people, that their cognitive skills have been affected by their chemotherapy. Are you able to speak to the sort of things we can do to help with that, Erin?
I saw that comment too, a kind of a mix of the cognitive skills, and maybe that translates a little bit to having difficulty finding words or feeling like your speed of processing is a little bit off from what it used to be. And that's certainly something we can help address in speech therapy. When we're kind of branching into that language and cognitive zone, it's also something that occupational therapy can help to address in some aspects as well. But speech therapist, occupational therapist, particularly one who's specializes in cognitive rehab program, would be able to do a really comprehensive evaluation to determine where are the functional breakdowns. And then again, from a treatment approach, we're considering two different perspectives, the restorative and the compensatory. So there are compensatory strategies that we can help recommend to help with the daily communication and to help make the activities of daily living a little bit more functional and easier to manage. But then we can also kind of hone that skill itself. So even though we're talking about the brain versus a specific muscle group, repetition of a specific skill and activity is just as important as kind of rebuilding that quote unquote muscle in your brain as it is with other muscle groups in your body. So there are plenty of activities that we can do to address that, as well as talking about some of the other side effects of chemotherapy, such as fatigue. Those can also play a really big role in how you're feeling that your cognitive function is changing throughout treatment. And that's another really important piece that we can help educate on and manage as well. So if that's something that you're experiencing, I would definitely recommend following up for a speech therapy evaluation and determining, where we can best help you in that respect.
Excellent. Yeah, as an occupational therapist with an interest in cognition, I do find that people are concerned that, this is something that won't change. And I think that we have the opportunity to make very significant changes functionally for these people. So I appreciate it. Let's keep going with these questions. Okay. I had a large B-cell lymphoma in my femur in 2018. I now have a knee replacement and femur and hip replacement. I had 8 RCHOP treatments through May 2019. My immune system is not the greatest. My oncologist will not allow me to go to a facility due to COVID. I did have a therapist in the home, but that is not allowed now either. I have exercises to do from the therapist, but there's nothing like a hands-on coach. I'm floundering. What can I do in the future? ReVital offers tele-rehab, physical, occupational, and speech therapy in many locations throughout the country. So I really encourage people to look up on our website where our locations are. And if we're in your state, we can do tele-rehab with you. If you are on this Zoom, we can do tele-rehab with you. And we have a great little demonstration that can show you in a couple of minutes. People think if they're not getting their hands on me, it's not the same. I can tell you that we can really affect some change via tele-rehab. So other questions coming in. Will radiation, I think this is one to start with Dr. Stubblefield, will radiation continue to atrophy muscle, and does physical therapy help counteract that? And then will PT build back muscles? So maybe we'll go to Hillary for that one.
Yeah, so I see in my practice, and I didn't introduce myself either earlier, but my name's Hillary and I'm a physical therapist in St. Louis, Missouri. So thanks for having me. But yes, we work with patients all throughout the continuum of radiation. So sometimes I'll see patients before they start radiation. Often I'll see patients during, and what it sounds like in this case, at the conclusion of radiation to be able to restore motion. So what we really look at from a physical therapy outlook is, what's changed and what are what's tissue has been affected by the radiation, depending upon what the disease state is. I see a lot of patients that are walking through pelvic cancer. And so for me, I'm really looking at the whole radiated field and what tissue may have been impacted and what are ways that we can restore the flexibility and the movement of that tissue and give you exercises to make sure that you know how to check to see if your flexibility is staying in a normal range and which exercises you can do to maintain that, as well as signs or symptoms that the tissue is getting tight or that you may be having some more limitations, so that you know, oh, this might be a good point for me to check back in with my therapist, or for me to get back into my exercises a little bit more diligently. So the treatment looks really different. Again, I see a lot of patients with breast cancer as well. And so looking at shoulder mobility and the field that was radiated and how that will affect the joint. So with for many patients that have radiation to either tissue that's over a joint, we want to make sure that the joint still can move healthy and that it's very flexible and that you have exercises to maintain that, as well as surrounding and adjacent tissues. And most importantly, what's that tissue flexibility? What's required for you to do your day-to-day activities and the things that you care about? Is it reaching? Is it bending? Is it a specific activity? And if you're being limited by tissue stiffness or pain, how can we help to ensure good flexibility and tissue mobility, as well as strength of surrounding areas, so that you can continue to do those meaningful things with less of an impact?
Great. I was hoping I could chime in on this too, because this is one of my, personal sort of favorite things to treat. I get a lot of radiation late effects patients, head and neck and Hodgkin survivors. And I think Hillary's spot on. I don't know that we really can do a very good job of actually increasing the muscle. What we're really trying to do with our therapy is work around those impairments and make the patient as functional as possible, despite the fact that you might have a patient who comes in trouble lifting their head up from head and neck cancer radiation or Hodgkin's radiation. We're not necessarily making the neck thicker and stronger like we would, because there's too much neuromuscular damage from the radiation. What we're doing is improving the posture, getting the shoulders back, doing manual techniques, getting the head in the right position, trying to condition those muscles. So even if they didn't get any stronger at all, which they might get a little bit, that's not really our big goal. That patient will still have better function, quality of life, less pain. And we see this all the time from the intervention. So we're not curing this. We're not turning you into a bodybuilder, because we can't do that in those settings. We are able to make you better in spite of a disease that is generally progressive.
I was first diagnosed with Hodgkin's lymphoma in 1978 at age 16, radiation treatments and chemo. Diagnosed with bladder cancer in 2016, suspected due to long-term effects from radiation. I've also developed dropped head syndrome and been helped somewhat by PT. It is suspected that is to the result of nerve and muscle damage. I'm very happy to see the attention given to cancer rehab. Thank you for that. And as someone who really enjoys treating all cancer patients, but especially head and neck, I will say that we have been able to see patients even in this Tennessee market that did benefit from physical therapy for the dropped head syndrome. They were able to get some strategies to improve their posture, to be able to stretch at home, to improve. Some of the research is now suggesting if we can improve posture, it may improve swallow as well. So I hope that you found a great therapist, and for anyone out there that's dealing with that, please look for a cancer rehab ReVital specialist. Hillary, is there anything that you wanted to add to that?
No, I think you covered it. The only other piece is, it just sounds, when we look at like the whole picture. And so I think just thinking about, that's another benefit of having like Erin on the call and you, like, we all work in different disciplines. And so I think too, it's always good if I've worked with a patient and we've made good progress, but I want to get an idea if I'm missing something else, I'll get another set of eyes as someone else who has a different background of expertise to say, again, but has the same expertise in cancer care, to say, okay, look, are there anything else that we could do to adapt? And so, like you said, it sounds like they got a great therapist, which is awesome. And if they ever feel like they're getting stuck, they could always ask, is there someone with a different discipline who could look at this from a different angle and see if there was something else that we could offer or address, just to kind of switch things up.
Yeah, and if I can chime in on that as well, because I think there is a difference, right? It just, thinking about a doctor, you wouldn't want me to take out your spine tumor. I'm a rehab doctor. By the same token, you don't want your cardiologist treating your neuropathy, because they're just not as skilled at it. There is, even some of the best therapists in the world, if they haven't had sort of an experience which I found with Hodgkin's is finding a therapist who really knows neuromuscular medicine, really knows manual technique, I personally found to be worthwhile. And a lot of times it'll be having the therapist who already is a superb therapist talk with somebody, as Hillary's sort of suggesting, who might have more experience in this field. And that's what we're trying to bring through the ReVital program, is really creating a culture of people who really have a tremendous amount of knowledge and skill in very complicated, difficult to treat conditions.
I've got just another Hodgkin's lymphoma question. I had Hodgkin's lymphoma, finished 6 cycles end of September that thankfully brought me remission. I was left with some neuropathy, especially leg muscles and knees, quite a lot of weight gain, still feeling tired. Are these normal side effects, and will they eventually pass? Neuropathy is much better. My knees hurt still, but they're better than immediately after chemo. But I continue to put on weight, although I'm not eating a lot anymore. I used to in the last 6 months of chemo, and after finishing it. Will my body ever go back to normal? I am 36 years old. Thank you. So we'll start with Dr. Stubblefield and then maybe bring Hillary back in.
Yeah, no, that's a great question. I'm actually, so much of what I see in Hodgkin's are people who were treated years ago, like a couple of the other questions, and got high dose radiation. Hodgkin's treatments moved to be largely chemotherapy based. But chemotherapy is not exactly a benign treatment. It causes a lot of muscle mass, what we call sarcopenia, can cause neuropathy, and can cause exactly what you're describing, pain, weakness, all that sort of thing. And the short answer to your question is, will you go back to normal? Is no, not necessarily. Just like a training athlete can get better, it does take some work to get back to the highest possible level. Your body's not gonna, it's gonna want to heal, and it will get better, but getting to your highest possible level. Hillary, chime in on that.
Yeah, so I think I'm really glad, first of all, that you're asking these questions, because again, like, this is the point. You're 36 years old and you're trying to decide, you know, is this what's my new normal? And I will tell you right now, that is my pet peeve phrase that I hear patients told or talk about, because what you just stated, what's expected? What is normal? Should I be okay with this? And the answer is, we don't know. And that's as Dr. Stubblefield said. So what we're really encouraging everyone to do is to really take an investment in finding out your potential. So what you want to do is you want to, like, in terms of the fatigue, you know, and again, the same with the neuropathy, everyone handles things different, depends on how your body, which agents that you have, how long your treatment lasted. But my advice would be to start working with somebody and see how you do, and just have very transparent conversations with your therapist and saying, you know, like, how am I expected to progress? And I would base your progress on the things that are most important to you. So instead of setting a goal necessarily of like, okay, this is what my symptoms are, see how your symptoms relate to your function. Like, what are they keeping you from doing? You know, you said I'm 36, the rest, what do you want to do? What's important to you? Are you training for a 5K? Is that something that's important to you? Do you want to be able to grocery shop without feeling like you're totally pooped by the time that you get home? And so I would start making some like function goals of what would define success for you, like less symptoms of discomfort in my fingers and toes by the time I finish shopping, or I'd like to be able to, you know, do 2 loads of laundry without feeling like I just ran a marathon, and start working towards those functional goals and see how you progress. So I will say, just from my clinical practice, the thing I tell patients is that, you know, this isn't going to make anything worse. Most often we can make at least some kind of change, and a lot of times we make a big difference. And so I think that the first step would be to start the dialogue, outline how you would define success, and then start working towards that, and then chart your progress. But no, I don't think that you should settle for a new normal until you've done everything that you know how of and worked with people to help you uncover your potential.
I think that's a really great place to finish up, Hillary, but I could not agree more. I remind people that, remember, if you say get the flu, how you feel after a week in bed, you know, and you think you're ready to go back to life, but you go back to life and you're like, oh, I'm still feeling that. So cancer and its treatments, they stay with you. And I think it's really important to know that there's help out there, but that we can also, we can affect change. It's got to be important to you, and often it's some work, but there's definitely experts out there to help people. We had some great questions. I really want to thank everybody for joining us today. It is almost time to finish up. I will ask that you join us for the rest of our Living Well Beyond Cancer series. The next topic will focus on mindfulness and emotional support with Dr. Lauren Vocaturo, and that will be in March. In May, we're going to explore cancer-related fatigue with Audrey Stockwell, PT and ReVital Program Director in Louisville, Kentucky. Watch out for the rest of our sessions throughout the course of 2021. Check out our social media pages for regular updates, or visit ReVital Cancer Rehab, Living Well Beyond Cancer, to register for upcoming sessions and watch previous sessions at your convenience. We are recording today's call. We hope you found today's topic valuable, and we look forward to sharing more topics from our panel of experts in the coming months. You can also learn more about ReVital in general, locate your nearest therapist, as I said, ReVitalCancerRehab.com. And if you would like to speak with a ReVital therapist directly to find out if cancer rehab might be right for you, please call 844-473-8485. I'll say it again, 844-473-8485. Thank you, and we hope to help you live well beyond cancer.